My name is Dr Imogen Norton and I'm a children's doctor. There's been a lot of talk in the media over the last few weeks about Streptococcus A. This is a bug that's been around for a very long time and we know a lot about it, but the levels of it are much higher than they would normally be, and it's been causing a lot of concern. Generally, the illnesses that are caused by this bug are very mild and most children recover completely, often without any treatment, although antibiotics are available in case they're needed. The most common symptoms include a high fever, tiredness, a sore throat, and a rough sandpapery type rash. If your child had those symptoms, it would be worth getting medical help by calling 111 or visiting your GP in case your child needed a course of antibiotics. Encourage your child to drink fluids regularly. If they're having problems with vomiting, then you may need to give them sips of fluid little and often. Nowadays we tend to give our children a lot of water, but this doesn't have the salt and sugar in it that they will need. So it would be important to give them some rehydration fluids or even some sugary drinks. Sometimes your child can become much more unwell with Streptococcus A because the bug gets into the bloodstream or into the lungs. In these situations, your child will be far more unwell. Usually when your child has a fever, they tend to settle with paracetamol and ibuprofen and perk up quite a lot. But if your child wasn't doing that and was very lethargic, that would be a cause for concern. Children also tend to go off their food when they're ill, and again that's very normal. But if your child's unable to keep any fluids down and isn't passing urine regularly, at least once every 8 to 12 hours, that would also be worrying. Your child may also have problems with their breathing if the Streptococcus A is affecting their lungs. In little children, they may just breathe very rapidly, or their chest might suck in, or you might hear some breathing noises called grunting, which would be cause for concern. If your child is particularly unwell, it would be important to get medical help quickly. If you do not think your child is unwell enough to come to hospital, then we would suggest having your child seen by a pharmacist or by their local GP. Failing this, call 111. Usually the symptoms of Streptococcal A are, like most other illnesses, very mild, and your child will be fine at home. It's important to keep an eye on them though, and if you are worried, to seek medical advice. It's important as a parent to trust your judgment on this.